expectation about diabetes and how to beat diabetes. So the lifestyle for optimal health is you have to get sufficient sleep. Those who do not get sufficient sleep actually have higher rates of diabetes. And sufficient sleep is really around minimum 7 hours of sleep per day. And the best sleep is between 10 and 2 a.m., which is when you get the highest quality of sleep. So the entire biological aberration is associated with a diet generally high in processed sugar, high fructose corn syrup, cooked animal protein and fat, trans fat, low in fiber, as well as lifestyle lacking in exercise and adequate sleep and the presence of depression. So now artificial sweeteners have also been linked with type 2 diabetes. So these that you see in the slide do not prevent diabetes, but actually contribute to it, according to the study done by Jennifer Nettleton in 2009. And some of these are listed, such as sucralose, aspartame, saccharin, and maybe you have seen these as an ingredient in different type of drinks, including almond milk or soy milk. Oftentimes they will tell you this is unsweetened, but if you check the ingredients, it contains sucralose, which actually tends to be even worse than the regular sweeteners. So let's talk a little bit more about that. So there is a 14-year study with 66,000 middle-aged French women. And what they found based on this research is that 1 can of soda per week increased the rate of type 2 diabetes by 30%. Well, it says 33% here. And 2 cans of soda weekly increases the rate of diabetes by 50%. And 1.5 cans of diet soda weekly increases the rate of diabetes by 15% of regular soda drinkers. So diet soda is even worse than regular soda. And so if you had 50 ounces of diet soda, and based on the study, the risk of diabetes increases by 60% as compared to regular soda drinkers. And as you know, aspartame is the most frequently used artificial sweetener in soda. And you can see regular soda drinkers are 10 times more likely to get type 2 diabetes, according to Dr. Robert Luswig of University of California. So obviously, drinking diet soda or any type of soda is not good for diabetes. Diabetes often does not get diagnosed until, oh, actually, I missed one slide here. So antibiotics have been shown to cause blood sugar dysregulation as well. And you already have heard of these antibiotics that are listed on this slide. And a possible mechanism is toxicity to the beta cell function and disruption of the microbiome. So you've heard of that if you take antibiotics, it destroys your microbiome. And for clients, if they've had to take antibiotics, let's say for surgery, what we have seen is some of these clients develop gastritis. We have even seen clients who've taken pain medications or antibiotics. They developed also diverticulitis. And also we recommend that if you take antibiotics, it's preferably that you take probiotics 2 hours after every dose of antibiotics until you finish the course. So you can see different type of antibiotics associated with severe blood sugar abnormalities and dysregulation. And Avelox is most associated with blood sugar disorder and diabetes. And Cipro, you've heard of that one. That's the third one, most toxic for diabetes. And like I said, the mechanism of antibiotics is that it possibly destroys the beta cell function. And also, of course, it disturbs your microbiome. And we have a completely different class about that as well. So diabetes often does not get diagnosed until its complications begin. And oftentimes, a patient will start developing retinopathy, so they will start going blind, neuropathy, inflammation in the nerves, and also they will get nephropathy, inflammation in the kidneys. And we were actually able to reverse these conditions within several weeks for clients. And nephropathy, it is a kidney disease, but also people who have diabetes have issues with coronary disease or vascular disease, different type of coronary diseases, but as well as depression seems to be related to diabetes on its own, and gastroparesis, which means your stomach does not empty well. And we also found an increase in cognitive decline in Alzheimer's, like double the rate. So all of these happen chronic degenerative effects of diabetes. So all of these start happening before people start getting diagnosed. On the positive side, we had clients, every single person we worked with who was implementing and worked with us one-on-one, their kidney function improved. We had different cases where clients' kidneys were failing as a result of diabetes, or they were failing because of an autoimmune disease. So their kidney function improved. But we also had a client here who had gastroparesis, and he has seen different doctors. You can see he tried drugs like PPI, H2 blockers, CT scans that showed nothing. He saw several functional medicine doctors. He tried ozone oxidative therapy. He took many herbs and supplements, and the doctors could not figure out why he had gastroparesis, but it was actually his diabetes that caused him that. As you can see from the previous slide, gastroparesis is a symptom of type 2 diabetes. And in that program, he mentioned to us his blood sugar at the end of the day after all three meals. It used to be over 125 almost all the time. And in that program, within 6 weeks, his blood sugar went down to 89. And then we had other clients whose A1C dropped by 0.4 points in 28 days because they retested their blood works. They were no longer pre-diabetic in just 28 days working with us. And you can see this is a client, Miguel, that we helped get with gastroparesis, and he had hair loss, poor circulation. And he said that he's gone days without being able to go to the bathroom. And sometimes more. There were more than 3 to 4 days where he didn't have a bowel movement. And he used to take tons of supplements and overload himself on laxatives just to get myself to go a little bit more often. And sometimes he would get so constipated that I would spend an hour in the toilet and even bleed sometimes. It was absolutely horrible. Let me tell you guys, this is what he wrote in a client group, private client Facebook group. He wrote, "This is my third day in the program, and today I had three bowel movements with zero effort. In fact, this is a client that we worked with back in 2019, and he still tells us he's doing great to this day and doesn't have these issues anymore with his blood sugar or gastroparesis." So let's talk about the next topic and the effects that diabetes can have on our cognitive function. So every 10 years somebody had diabetes, the brain appears to be 2 years older than someone of comparable age who did not have diabetes. So the higher your fasting blood sugar is, the more the brain decreases in size. And the longer people had diabetes, the greater rate of brain inflammation and dementia that they had. And the point is the brain size of diabetics decreases twice as fast as non-diabetics. So diabetes doubles the rate of brain shrinkage. This is what the slide, and this is a study that showed that. And so fasting blood sugar of more than 126 is the diagnosis of diabetes.